Hysterectomy is a procedure where we remove the uterus. We cut the blood supplies from the side of the uterus and cut all the ligaments and take out the uterus. It can be done vaginally or abdominally, different ways to take out the uterus, and after this people will not be able to have children anymore. It's a permanent procedure of taking out the uterus. It is done for many reasons. One is heavy bleeding causing anemia. Sometimes people have tumors on the uterus which cause severe pain and bleeding and very painful periods. Sometimes endometriosis is another reason, and uterus falling out is another reason, and chronic pelvic pain that does not respond to any medications. And we try injections, medicines, and if nothing improves it, then a hysterectomy is done for that reason as well. Hysterectomy can be done vaginally or abdominally. Vaginally means you're in the normal lying down position. In the surgery, you'll be under general anesthesia, and the legs will be up in stirrups, and we use instruments so we can see the cervix, and gradually, one by one, we'll cut the ligaments and take the uterus out. It is less invasive than the other methods of hysterectomy, where we have laparoscopic hysterectomy, where they have few holes in the abdomen, and the surgery, most of it is done through the abdomen, and then the uterus is taken out vaginally. And the other way to take it out is abdominal hysterectomy. Abdominal hysterectomy, you'll have an incision on the abdomen, which will be like a bikini cut, or midline and straight in the mid from the belly button to the pubic symphysis or to the pelvis. And abdominal hysterectomy is done when there is tumors, big tumors that we cannot take out vaginally, when there are big cysts that are suspicious to be precancerous or cancer, or when somebody has multiple cesarean sections or multiple abdominal surgeries which make the cervix go up and then cannot be accessible vaginally. Sometimes we cannot see the cervix vaginally, or it's too high and it's hard to take those uteri out vaginally. So we do abdominal hysterectomy in those conditions. There is risk of hysterectomy. Normally, we do not transfuse hysterectomy patients if the blood loss is less, but if there are large tumors which are very vascular, or if the patient is already anemic and she bleeds little more than normal, there is a possibility of blood transfusion at the time or after hysterectomy. If you already start anemic and if you lose some blood, then you need some blood to cover the blood loss. Other risks are injury to the bladder, which is very close to the uterus, injury to other organs, intestines and other things. Very, 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 very rare, but depending on how many previous surgeries you have had, how many scar tissue you have, how much adhesions or cicatrices you have, there is other risks. Most of our hysterectomy, the risk rate is very, very low with our surgeries. Recovery-wise, vaginal hysterectomy, the recovery is very fast. People recover, some even within 2 to 3 weeks and sometimes 4 weeks. We take them off work for 6 weeks. It's recommended to take rest or not lift anything heavy for 4 to 6 weeks. But there are people that are able to work a little earlier if they have to. Abdominal hysterectomy is a little more invasive because there is incision on the skin. So the pain, apart from the taking out the uterus and the ligaments, from the skin to the fascia, there is always pain from there. So the recovery is a little longer at 6 weeks, sometimes a few more weeks period. A lot of people do not come to get uterus removed because of several myths they have that when the uterus is out, they're not a woman anymore. And it's also believed by some women that there is change in sexuality and they're not going to feel, it's going to feel different. And those are just myths. And after hysterectomy, after 6 to 8 weeks of hysterectomy, slowly everything returns to normal, and the risks, and it does not change anything. You can see the testimonials from patients that have had hysterectomy. It does not change anything except that they will not be having periods anymore. There is also belief that after hysterectomy, some people gain weight. Hysterectomy by itself does not make you gain weight. If we just take the uterus out, there is no need for any hormones. Some people think that just by taking the uterus out, they will need hormones. Only when the ovaries are taken out along with the uterus, then people need hormones, and it will put them through menopause or start having menopausal symptoms. So once the ovaries are out, that's when people start having menopausal symptoms. Just taking out the uterus will not make them menopausal.